Queensland Premier Anastasia Palaszczuk says the state has recorded 8 deaths from COVID-19 and 5,854 new cases were confirmed in the latest reporting period. Key points. The Chief Health Officer says half the Queensland population is expected to have been infected with the virus by the end of the month. The Chief Health Officer says half the Queensland population is expected to have been infected with the virus by the end of the month. Premier Anastasia Palaszczuk says the mask mandate will be reviewed at the end of February. Premier Anastasia Palaszczuk says the mask mandate will be reviewed at the end of February. Large parts of Queensland have either passed the peak of the Omicron wave or are approaching the peak. 2 of the 8 deaths were in aged care. The rate of hospitalization has continued to decline, with 579 people currently in hospital with the virus, 46 of whom are in intensive care. Nearly 60% of eligible Queenslanders aged 16 and over have received a booster shot. Since January 6, more than 3 million rapid antigen tests have been distributed to Queensland hospitals and health and ambulance services. Ms. Palaszczuk said new COVID modelling indicated the state had passed its peak of hospitalizations. Our initial modelling, we looked at anywhere between 3,000 to 5,000 people we were expecting going into hospital, and around 300 to 500 people going into ICU, Ms. Palaszczuk said. Instead, we've had a peak of 925 in hospital and 71 in ICU. As you heard today, that is down to 579 in our hospitals and 46 in ICU. So based on that modelling, we can be cautiously optimistic that as a state, our hospitalizations have peaked and are trending down. It means our precautions and planning have been working. Ms. Palaszczuk said the mask mandate would be reviewed at the end of February. Large parts of Queensland passed the peak of Omicron. Ms. Palaszczuk said the Gold Coast, Metro North, Metro South, Cairns, Sunshine Coast, West Moreton and Mackay regions had passed the peak of the Omicron outbreak. Queensland COVID-19 snapshot in latest reporting period, deaths, 8. 8 new cases, 5,854 Queensland's vaccine rollout, percentage of those aged 16 plus first dose, 92.25%. 92.25% second dose, 90.08% latest case information from Queensland Health. Townsville, Wide Bay, the Northwest and Torres Strait Cape were approaching a peak, while the Darling Downs and Central Queensland are yet to reach a peak in infections. We're still coming down off that peak, and of course, we're going to also see a tail end in March, and of course, we'll be preparing for a flu season in the winter months, Ms. Palaszczuk said. It is estimated 8.7% of the Gold Coast population and 8.1% of the Cairns population have had the virus. Chief Health Officer Dr. John Gerard said the real number of people who tested positive on the Gold Coast could be 5 to 10 times what was reported after a survey found many were unaware they were infected. Dr. Gerard said it was still credible to assume half of the Queensland population would be infected by the end of the month. Our initial modelling suggested that up to 50% of the Queensland population could be infected with this virus by the end of February, and I think that's very credible. He said vaccinated Queenslanders had a wall of immunity, but the effectiveness of vaccines during future COVID waves remained unclear. Chief Health Officer Dr. John Gerard says half of Queensland's population will have had COVID-19 by the end of the month. AAP, John O'Searle. Dr. Gerard said 231 children between the ages of 5 and 17 years had tested positive on PCR tests, down from 295 cases yesterday. It's very early to see any impact of schooling on the transmission of the virus among children, Dr. Gerard said. There was clearly quite significant transmission among children in the 3 weeks leading up to the opening of schools. So there will be some immunity among children, but we still expect more cases to be seen in schools. More than 40% of children aged between 5 and 11 have now had 1 dose of a COVID vaccine. Pressure eases on hospital staff and paramedics. Health Minister Yvette Dieth said an additional 300 Queensland Health and ambulance staff had returned to work in the past day. Our number of staff that are having to isolate and quarantine across health and ambulance services have declined again overnight, she said. We're now at 1,830 staff, that's down from 2,148 yesterday. We hope that takes a bit of pressure off. She said many Queensland hospitals now had just 1 or 2 wards dedicated to treating COVID patients. Remembering at our peak, we had 9 wards dedicated at Gold Coast Hospital alone just for COVID, Ms. Diaz said. So it's good to see a bit of relief coming for our health workers. Space to play or pause, M to mute, left and right arrows to seek, up and down arrows for volume. Watch duration, 2 minutes 3 seconds 2 minutes, and 3 seconds. Data shows many older Australians haven't had their booster.